Hi, welcome to the Pullman Regional Hospital Joint Replacement Preparation class. I'm Maile Keller, a physical therapist assistant and the orthopedic care coordinator. I'm one of the many total joint replacement team members who will be partnering with you, your surgeon, and your family to help make your surgery successful. This class is a brief overview of what to expect before, during, and immediately after your hospital stay for your total joint replacement. This class is intended to help prepare you for your joint surgery here at Pullman Regional Hospital. I'm excited to have this opportunity to help guide you through the total joint replacement process. Surgery can be a stressful process, and our team is here to help you prepare, participate, and restore you back to an optimal level of your activities and life. Our dedicated multidisciplinary team of professionals includes your orthopedic surgeon, physician hospitalists, physician assistants, nurse anesthetists, nurses, physical therapists, occupational therapists, pharmacists, dietitian, discharge planners, and an orthopedic care coordinator. We believe you play a vital role in your success and recovery. Our goal is to involve you in your treatment through each step of the process. Your total joint replacement journey begins at Inland Orthopedics with one of our 4 orthopedic surgeons. You will meet with your surgeon, who will make an individualized surgical plan for you. Here at Pullman Regional Hospital, the total joint team is here to support you during each step of your total joint replacement journey. I will be taking you through 6 stages of the total joint experience, including getting ready for surgery, what to expect the day of surgery, your hospital stay, discharge planning, what to expect after surgery, and your recovery at home. There are a few things to consider as you prepare for surgery. Being at a healthy body weight and good physical condition improves your surgical outcome and helps you to recover faster. Optimizing and managing any chronic medical conditions before surgery helps to prevent complications. Talk with your primary care provider or your surgeon about outpatient pre-physical therapy to gain strength and range of motion. Your surgeon will talk with you about stopping nicotine use. Now is the time to start planning for your discharge home. Nutrition and dietary health play a vital role in preparing for surgery and also to help your body recover. Joyce is going to share a few tips on how to best prepare your body with nutrition as you are getting ready for surgery.
Hi, I'm Joyce Marshall. Meeting with one of our registered dietitians to discuss an individualized nutrition plan can help prepare for surgery and recovery. They can assist you with your dietary goals and needs and help you navigate the room service menu. If you have diabetes, it's important to keep your blood sugars within an ideal range to ensure proper healing. Our dietitians can help you choose foods to help manage your blood sugars. There are benefits also to keeping your weight within an ideal range. A healthy weight range maximizes the longevity of the joint replacement, decreases the risk of post-op infection, and lowers the odds that you will face problems after surgery. Improving your weight will significantly benefit the outcome of your total joint replacement.
Your surgeon will review your medications with you. He will tell you if and when you need to stop any medications prior to surgery. Andrea is the Director of Pharmacy and is going to talk about medication management.
Hello, my name is Andrea Howell. You will meet with a pharmacist to discuss your medications at your pre-op visit. Please remember to bring a list of your home medications, including prescribed medicines, any nutritional supplements, and over-the-counter medications. We will discuss a personalized plan with you regarding your medications and what you need to be taking or not taking between your pre-op visit and surgery. You may be asked to bring in certain medications that the pharmacy does not carry, such as specialty items. In general, the pharmacy will provide your medications while you are here at the hospital. Before you leave the hospital, a pharmacist will go over the medications you will be taking at home. Your prescriptions will be called into the pharmacy of your choice, or they may be given to you in a written format.
Respiratory health involves both cardiac and pulmonary health. Pullman Regional Hospital has a respiratory team who will be involved in your care.
Hi, I'm Jennifer, Assistant Director of Cardiopulmonary with Pullman Regional Hospital. Our respiratory therapy department is also part of your total joint team. After surgery, we will be assessing your respiratory needs, including oxygen saturation, proper breathing techniques, assisting with your CPAP machine if you have one, and managing your respiratory inhalers. If you use a CPAP machine, please bring it with you as the hospital does not provide them. We will also make sure your CPAP is working properly. If you have pulmonary disease and use inhalers, please bring them to the hospital and the respiratory therapist will assist you with them after surgery. Another key component to your total joint surgery is healing. Nicotine use impairs the healing process and smoking compromises the respiratory system after surgery. Now is a good time to stop smoking and discontinue any nicotine use. Your physician can help guide you through the smoking cessation and assist you with getting medications or patches that can help you with stopping smoking and nicotine use.
Carol is a patient financial counselor at Pullman Regional Hospital. She is available to answer your questions about hospital billing and any out-of-pocket expenses. Ashley is one of the pre-admit nurses. She is going to tell you what to expect from the pre-admit phone call.
Hi, my name is Ashley Meyer, and I am one of the pre-op nurses at Pullman Regional Hospital. Before surgery, your surgeon's office will schedule a pre-op visit at Pullman Regional Hospital. This will take 1.5 to 2 hours. During this time, you will meet with a pre-op nurse who will assist you in completing your medical history and information required for surgery. We will give you important pre-surgery instructions to ensure a safe and successful total joint surgery. At the pre-op visit, you may have labs drawn, an EKG done, and we'll meet with a pharmacist, a physical therapist, and a hospitalist if requested by your physician. Things to bring with you to the pre-op visit: ID and insurance cards, completed health questionnaire, list of all medications including supplements, vitamins, and over-the-counter medicine, allergy list, advance directives, family member or a friend. The night before and the morning of surgery, you will not be allowed to eat anything after midnight. Your pre-op nurse will give you instructions on your specific fluid restrictions for the night before and the morning of surgery. It is important that you shower the night before surgery and the morning of surgery using your regular soap. Make sure to use a clean towel, dress in clean clothes, and sleep with clean sheets and blankets. Do not shave or use lotions, powders, or creams anywhere on your body after you shower. It is equally important that you avoid sleeping with any pets the night before surgery.
Please note the following updates and changes. You will have a pre-admit phone call with a nurse from Pullman Regional Hospital. It is not typically in person any longer. Your pre-op visit is with the surgeon. A medical questionnaire is no longer mailed out to you. You will use Hibiclin soap given to you by your surgeon's office, not regular soap. Here is a list of items to pack and bring with you the day of your surgery. Now we're going to talk about the day of surgery and what you can expect. When you arrive at Pullman Regional Hospital, you will come through the main entrance and check in at the registration desk. From there, you and your support person will be escorted to a pre-op room where the nursing staff will begin to prep you for your surgery. Pain control is achieved by a variety of methods. One of the nurse anesthetists will meet with you before you are taken to the operating room. Dave is going to share what to expect when meeting with the nurse anesthetist.
Hi, my name is Dave. I am one of the certified registered nurse anesthesiologists here at Pullman Regional Hospital. As a group, we are committed to providing you with a great experience while you undergo your joint replacement surgery. There are many different options for anesthesia when you undergo surgery, and the anesthetic is tailored to you and your individual needs. On the day of surgery, and in some instances before, someone from our anesthesia group will meet with you and discuss your health history. With this in mind, we will go over the options and make recommendations regarding your anesthetic to ensure your safety and the best possible outcome. The type of joint replacement that you are having will often play a role in the decision and the anesthetic technique used. We will often use spinal anesthesia, general anesthesia, or a combination of both. As well, we often are able to utilize different nerve blocks to help with postoperative pain control. With a great anesthetic plan in place, off to surgery you'll go. Once in the operating room suite, we will begin to and continue to monitor your vital signs throughout your surgery. We will also continue to provide different medications throughout your time in surgery to ensure your safety and comfort. We are with you the entire time, continually watching over you, every breath, every beat, every second. Following surgery, you will be taken to the recovery room where the medications that we have administered will begin to wear off. As these medications begin to wear off, we will continue to work with your surgeon and your nurses to keep you comfortable, often using a mixture of IV and oral pain medications. We look forward to working with you to ensure your safety and providing you with a great anesthetic when you come to Pullman Regional Hospital for your joint replacement surgery.
Once in the operating room, your surgery will take 1.5 to 2 hours. Compressive stockings are placed on your legs and help to prevent blood clots and reduce post-op swelling. If you are having a total knee replacement, your surgeon may choose to do a robotic-assisted surgery. After surgery, you are transferred to the recovery area in the post-anesthesia care unit. Vital signs, neural checks, pain management, and circulation are all monitored by your PACU nurse. Depending on your surgery and surgeon, you may be issued the following equipment: a sling for shoulder replacements, a CPM for knee replacements if ordered by your surgeon, a wedge pillow for posterior hip replacements. At Pullman Regional Hospital, all efforts are made to make your one-night stay safe and comfortable. Our patients recover in a private room with a private bathroom. Your meals are provided by the Red Sage Cafe via room service. There is a patient recliner and a guest sofa in each room. The surgeon will most likely order physical therapy and occupational therapy to begin a few hours after surgery. The therapist will determine when it is safe for you to get out of bed and begin your first therapy session. During your hospital stay, there are a few basic cares that you can expect. Caitlin Carl is going to talk about pain management while you are in the hospital.
Hi, I'm Caitlin Carl. I'm a nurse here on the Medical Surgical Unit at Pullman Regional Hospital. Because you are a part of the Total Joint Replacement team, you have a valuable role in working with your therapy staff and nurses to come up with an individualized pain management program. Your nurse will be assessing you frequently to ensure that we stay ahead of your pain, to allow you to participate in physical and occupational therapy, and to allow you the rest that you need to heal. One tool we use to gauge your pain is a pain scale that has scores from 0 to 10. We will ask you about the intensity of your pain, how long it lasts, and what it's like with movement and at rest. We usually use a 4-hour time frame to assess your pain, and we'll ask your permission to come in the middle of the night and wake you so we can keep your pain at a manageable level. Your nurse will plan to pre-medicate you so that you are able to participate in physical and occupational therapy with as little pain as possible. We also use other important pain-relieving measures such as ice packs, elevation, anti-inflammatory medications, and gentle movement. We look forward to partnering with you while you are here.
Our goal is to manage your pain effectively so that you can participate in your care and with therapies. We manage pain in multiple ways to achieve maximum comfort. Some of the other equipment you may find in the hospital room are ice packs, a walker, a gait belt, oxygen monitor, and an IV pole. Pullman Regional Hospital is proud of our low infection rates. All hospital staff are educated on infection prevention and follow strict protocols. As staff, we also educate our patients and their visitors on the vital importance of preventing infections. Joyce is going to talk about your post-op diet and nutrition.
After surgery, you may not feel hungry, so most likely you'll want to start taking in liquids such as broth, juice, jello, popsicles, or tea, and gradually work up to the solid food as tolerated. You will be able to choose your food from the menu provided in your room. In order to enhance healing, consider choosing foods high in protein, such as cheese, peanut butter, cottage cheese, yogurt, and milk, in addition to meats such as beef, pork, poultry, and fish. Since pain medications often contribute to constipation, you can consider eating foods that are high in fiber. Some examples of these are plant-based foods such as fruits and vegetables, lentils and beans, nuts and seeds, and whole grains like oatmeal. It is also very important to drink plenty of fluids to avoid constipation. If you are diabetic, keeping your blood sugar in an ideal range will speed your healing. By choosing the right foods, you can help with healing and avoid the constipation that comes along with pain medication, and get back to doing what you enjoy doing as fast as possible.
Occupational therapy plays a vital role in your total joint replacement. Your occupational therapist will work closely with you, your family or support person, and the rest of the team to prepare you for a safe discharge home.
My name is Kayla, and I am an occupational therapist here at Pullman Regional Hospital. After your total joint replacement, occupational therapy's role is to assess your safety and independence with self-care. This includes the essential yet fun activities of bathing, dressing, toileting, cooking, cleaning, pet care, and even more. Our team can help analyze your home setup and current abilities to determine if there is any equipment or assistance necessary that can help you to be more safe and independent. We will provide you with adaptive equipment such as a reacher or a sock aid if needed, and make recommendations for toilet risers, grab bars, bath or shower benches, and even more, so that when you leave the hospital, you can manage any precautions your physician may give you with ease and independence. This will also help significantly reduce your risk of falling. We find that practicing these basic yet functional skills during your hospital stay can help jumpstart your recovery and increase your confidence as you transition from the hospital. We look forward to working with you.
Your therapy begins a few hours after surgery. A lot of times, the physical and occupational therapist will see you together for the first visit. Your active participation in PT and OT will help speed your recovery and allow you to safely get back to doing things that are important to you. For your safety and best outcomes, your surgeon and total joint team ask you to do the following. Your surgeon and therapy team will have specific discharge goals. Before leaving the hospital, you will be given written, individualized instructions. This will include medications, diet, activity, incisional care, and post-op appointments. Physical therapy and occupational therapy have several goals for patients to meet before being discharged home. It is very important to have your discharge plan in place before surgery. Identify who will be your support person at home with you after surgery. Because all total joint replacement surgeries are considered outpatient procedures, insurance companies do not typically cover going to a skilled nursing facility for rehab. You will need some help at home after your surgery. Here are a few questions to consider. Before returning to driving, you must not be taking narcotic pain medications, and you must be cleared to drive by your surgeon. To wrap up, we are going to talk about home care and what you can expect when you're at home. Preparing your home before surgery will make your return home much easier. Here are a few tips. Planning easy meals in advance. Arranging for help to assist with housekeeping, shopping, or driving. Prepare a room on the main floor if you live in a multi-story home. Clear obstacles that could trip you. Determine what home equipment you need. Have a firm chair with armrests and a good height available. Do you have a walk-in shower or a bathtub? To avoid injury or falling and to have the best outcome, follow all of your instructions. It is very helpful to have your support person present while your discharge instructions are given to you by your surgeon, your nurse, therapy, and pharmacy staff. When you can safely return to work will depend on your profession, the type of joint replacement you had, your surgeon, and how well you are recovering. Give yourself time to heal and participate in outpatient physical therapy. If you want to receive updates from Pullman Regional Hospital and stay in the know, scan the QR code below to sign up for the hospital's Orthopedic e-newsletter. Your total joint team is here to help guide and support you during the entire total joint process. We thank you for choosing Pullman Regional Hospital and allowing us to take care of you. As your orthopedic care coordinator, I'm available to answer your questions, ease your concerns, and direct you to the appropriate team member. Your recovery and success is important to all of us.